What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
What's up, everybody? This is Dr. Zach Baker on the Strength and Knowledge Podcast, and today I've got with me Dr. Christian Huckfeldt, who is one of our sports residents. You will remember him from last month when he did a knee Journal Club article with us. And this month, he's back for another Journal Club article, and the topic of the month is the shoulder. So, Christian, do you mind talking to us a little bit about the article you selected and why you selected it?
Yeah, absolutely. I'm really looking forward to talking about this one. So the article I selected is called The Acute Effect of Pitching on Range of Motion, Strength, and Muscle Architecture. So anyone who knows me knows I'm a baseball guy. I kind of always have been. I played a little in college, and that's sort of where my interest lies. So that's kind of why I chose this article. I think the baseball research community has done a pretty good job in the last couple of years really delineating some of the changes in shoulder range of motion and shoulder strength on baseball athletes. And this study did a really good job at looking at more of the acute changes. So we know that the baseball guys and the pitchers are going to have that chronic changes in shoulder range of motion based on the bony adaptations and the humeral torsion as guys are younger and throwing a lot more during adolescence. But we know there is a significant acute change in shoulder range of motion and shoulder strength after pitching, and this study did a really good job at kind of highlighting what those changes are and then taking it a step further and discussing why those changes happen.
Yeah, and I think that's really good to point out that you had mentioned throwing is an unnatural motion for the human body, notably at the shoulder. And to accommodate that motion, there are going to be some changes that happen. And some of those are going to be acute and some of those are going to be chronic. And I think when we have an individual coming into the clinic or whatever setting you work in, needing to be mindful of the patient presentation that you have in front of them today. Is that something that you're just seeing within a 20 to 48 hour window? Or is this an actual representation of what that shoulder is able to do? Now, Christian, the $1 million question that before we get into this, you said you played a little bit of college baseball. You pitched, right?
Oh boy, yep.
All right. What were you bringing the heat when you're pitching, or what was your repertoire?
Yeah, I threw relatively hard for an average 6'1" Division III college pitcher, but strikes were not exactly my strong suit. So.
Yeah, you got the wild thing on the mound out there.
Double-digit strikeouts and walks kind of guy for sure.
There you go. So with this study, talk to us a little bit just about what were the type of people that the study was looking at? What was the patient population? What were some of the demographics we had? Did they have any inclusion or exclusion criteria?
Yeah, absolutely. So the study looked at 10 pitchers at Temple University's club baseball team. So if you're not familiar, Temple actually closed their Division I baseball team probably 5 or 6 years ago at this point. So this study was sort of the last remnants of those individuals who had maybe pitched a little bit at the D1 level and then also had just come to Temple because they were interested in the academics and also to continue playing baseball. So they had 10 pitchers, average age of about 20 years old, your typical college pitcher. The inclusion criteria was anybody who had greater than 5 years pitching experience, so it wasn't just somebody who decided to pick up a ball last week and start throwing. And really the only people they excluded were if they had a self-reported injury or surgery within the last 6 months.
Good. So we've got, you said average age about 20. We got college age guys. It is a club team, but a previous D1 team, and you're going to have some D1 roster carryover onto that. And the big thing is these are pitchers with a little bit of experience. They've been throwing for a while. This isn't just your weekend adult league that we're looking at. So I think it's important to appreciate with these studies what we're looking at and then also just seeing, does that match up with the same patient population you see, or just what are some similarities between the populations or things that you could deduce as being appropriate to generalize to a wide variety with that. So what were the actual metrics or measures that they were tracking in this study?
Yeah, so they looked at range of motion first, so shoulder internal and external rotation range of motion using bubble goni. They also looked at shoulder internal and external rotation strength using a handheld dynamometer. And the last thing they looked at was muscle architecture. So they broke that up into pennation angle, and muscle thickness, and they looked at the infraspinatus and teres minor.
Cool. Now, with the range of motion measurements, we mentioned internal and external, which obviously makes sense for a throwing population. Was it in a 90-90 position, abducted, shoulder at 90 degrees of abduction?
Yep.
Okay, perfect. And then strength testing the same, or was that elbow to the side?
I believe it was the same. I'd have to go back and look specifically, but I believe it was in the same position as where range was taken.
Okay. And then what were the actual findings? Did we see anything interesting happen with range of motion? Did we see anything interesting happen with strength or with some of the actual tissue changes?
Yeah, absolutely. So the individuals threw in a 60-pitch simulated game. So all of the measures I just mentioned, they were taken at baseline. And then the individuals threw in a 60-pitch simulated game broken into 3 20-pitch innings or so. They standardized the number of fastball, curveball, and changeup, but allowed the guys to throw it into random order. After the simulated game, all those metrics were taken again. And then they took those same metrics every day for 5 days after pitching, the same exact time every single day. And with that, they were told, each one of the guys, to not throw anymore over the course of 5 days and no upper body exercise. So they really tried to standardize what the guys were doing in between each day to allow to really kind of control for what was going on.
Good. I like that setup. So it sounds like we got some pre-measurements that were taken. Then they did their 60-pitch count, which was to kind of mimic that 3 innings, 20 pitches. We got post-measurements taken. Of those 60 pitches, it was standardized in regards to the type of pitch they were throwing. So we didn't have guys throwing 95 and another group throwing knuckleballs. They were all kind of throwing the same type of stuff. And then they got serial testing over the course of the next 5 days with the instruction to not throw any further. So what did they actually end up finding with the range of motion, with the strength testing, with the different metrics they were looking at?
Yeah, absolutely. So shoulder internal rotation range of motion decreased significantly immediately after pitching and actually didn't return to baseline until 4 days after throwing. So if you look at the stats, internal rotation range decreased by like 17% immediately, which is really significant, I think. And then over the course of a few days actually increased back up to baseline at that 4th day. There was no change in external rotation range. Now, when we dive into strength a little bit, there was no change in internal rotation strength, but external rotation strength significantly decreased immediately after throwing, and then that actually took 3 days to return to baseline. If you look at the numbers there, it decreased by like 11% or so immediately, and then took a couple days, about 3 days or so, to return to baseline. And that kind of makes sense with everything. If you think of the throwing motion, there's a lot of eccentric stress on the posterior cuff during the follow-through. So that makes sense that internal rotation range and external rotation strength were the 2 metrics that really decreased significantly. And kind of going off of that, the muscle architecture itself, they actually found that the infraspinatus pennation angle significantly increased immediately after pitching and took 4 to 5 days to return to baseline. And so through a number of statistical analyses, they were actually able to correlate the infraspinatus pennation angle with that decrease in shoulder internal rotation range of motion.
Those are some pretty interesting findings. I would say not unexpected,
Yep.
But just validates a lot of things that you would assume would happen just from the mechanical act of throwing. Admittedly, I was kind of surprised just at how significant it was. I mean, you talk about the range of motion and the strength losses in double digits from a percentage standpoint, and then the amount of time that it took to return to baseline. And I think when we talk about a lot of pitching and throwing related injuries, whether it's with our collegiate population, whether it's with our youth and high school population, a lot of it comes down to volume-based injuries. And I think this just further reiterates the fact that, especially for our young kids, it can take 4 to 5 days to return to baseline. So if we're pitching in a game on Friday and we've got a weekend tournament, we're not going to be in a very healthy standpoint from a safety or a performance standpoint to go back out on the mound Saturday or Sunday. So I think this is a great article just to appreciate some things that I would like to think is already relatively common knowledge, especially amongst people who treat the baseball population, but just I think for the entire PT field to appreciate how big of a toll throwing can take on the shoulder from a range of motion and a strength standpoint. Christian, do you mind touching a little bit? We talk about, like, what does this actually mean for us? I think we talked a little bit there just on the educational component, but from a treatment standpoint, if you have an individual coming in and you're assessing range of motion, you're assessing strength, but during your subjective history, you realize, hey, this person just started a game and threw 50, 60, 70, 80 pitches 24 hours ago, how is that going to influence what you take from your evaluation results and really how you act on them? And I know context of what they're coming in for is going to change, but if we know we have these drastic acute changes, how does that influence your clinical decision making?
Yeah, absolutely. I mean, I think first and foremost that highlights the importance of serial testing of all of these information, especially with range of motion. With that probably takes 30 seconds, 45 seconds to take. That's not something that takes a whole long time to take. So I think the serial testing of range as guys are in season, or even if they're in their off season and throwing, just so we know how its trajectory is moving and how it's progressing with throwing, I think is really important there. And secondly, I think for the treatment perspective, when we have these losses of shoulder internal rotation range of motion, especially acutely after throwing, I think it really highlights the importance of what are we going after to get this range of motion. I mean, if that guy comes into my clinic and I start going right to the shoulder joint itself and working on capsular mobs or working on the joint itself, I think I'm doing them a disservice, because this study showed that it's not the changes in the joint. The changes in the joint are not happening acutely. It's changes directly, specifically in the muscle. So with that, okay, so now we have to start thinking, how are we going to start improving that range by going after the muscle? And I think with that, a lot of kind of the research that we tell our patients now is, how are they sleeping? Are they getting 8 good hours of sleep a night? How's their stress management? Are they eating well? Can we get a higher intensity cardiovascular activity where they're having a lot of blood flow in, like a whole systemic effect? I mean, those things I think are huge for this population, rather than just going right to the joint and cranking on the joint, trying to get internal rotation from there.
Yeah, and I'm glad you hit on that, because I know going through school and early in my career, if I saw a throwing athlete and they were lacking internal rotation, it was kind of embedded into my brain, go after posterior capsule, try to increase mobility. We're talking sleeper stretch, some other cross-body adduction with overpressure. And not to say that stuff is inappropriate, but in this given scenario, it would be, because we're not dealing with either bony adaptations or capsular changes. We're dealing with adaptations in muscular tone, essentially. I think another thing to be mindful, not only in the actual type of tissue that you are addressing, are we going after capsule versus muscle and tendon, or is this a bony adaptation? I think we also need to be mindful of, how are we prescribing exercise for that individual? And if they're presenting with a loss of range of motion and a loss of strength because they just threw within the last 24 to 72 hours, it probably doesn't make sense just to shut them down and do nothing. But it also doesn't make sense to put them through a high-intensity strength workout either. So appreciating that there is a recovery period after throwing, and that recovery period is directly going to affect what you can do with them in the clinic from an exercise intensity standpoint, from a volume standpoint, and making sure that what we're doing rehab-wise is therapeutic, and it's not just compounding this acute or acute on chronic fatigue that they're experiencing.
Yeah, absolutely. And I think kind of what you had said there, I think it really highlights the importance of, I'll try not to go on my soapbox here, but when we're measuring both internal and external rotation range in our overhead athletes, especially in our pitchers, we need to be doing it side to side, and we need to be looking at total rotational range of motion. We know that with our baseball pitchers, we're going to have increased external rotation, decreased internal rotation as a chronic adaptation, as a bony adaptation to humeral torsion most likely. So with that, we can't just be looking at internal rotation saying, oh, they're 10 degrees short on one side compared to the other. Let's go crank at that joint and go get it. We need to look at the total range side to side, and if it's within that 5-degree difference side to side, that's pretty good. Now, like I had mentioned earlier, it's the serial testing is when we know if their internal rotation has changed pre and post pitching. So if I'm seeing somebody right after pitching for the first time and I notice their internal rotation might be a little bit less, I really need to wait and continue to go serial testing to see what is their baseline, how much did it decrease, and kind of go from there.
Perfect. These individuals coming into the clinic, what are some other things that we need to be mindful of, probably just with regards to like interdisciplinary communication, either with amongst our medical profession or just if there's somebody who's in season, what do we need to be mindful of communicating to coaching staff, strength and conditioning? Is there anything that comes to mind there, or do you just have any experiences in the past that this study kind of brings to light?
Yeah, absolutely. I think a lot of that depends on what person is in front of you. So in our youth population, I think that's a huge interdisciplinary opportunity to talk to the pitching coach and to talk to the parents and see, are they only pitching on one team? Are they pitching on multiple teams? Is there some low-hanging fruit that we can kind of attack from there rather than going more specific? Can we just make sure they're not throwing 12 months of the year? Can we make sure they're not throwing on 3 different summer teams at the same time? Whereas as you get into a little higher level baseball in college and especially in the pro level, I think that changes things because from the rehab standpoint, even if you're in playoff baseball and we know that our pitchers have a little less shoulder internal rotation range or external strength, guess what? They're going out there and they're throwing the next day because they're in playoff baseball. So that changes our mindset into thinking, okay, they're going to throw anyway. How can we do the best job that we can in making them as healthy as possible and decreasing those variables as much as possible to let them go out there and throw?
Context is always key, and I think that's where you had mentioned earlier, it takes 30 seconds to check range of motion, so do it frequently. It takes the same amount of time to have a conversation and ask a question. So just making sure that we're getting a very good holistic view of the picture we are painting for the situation that they're in, and then just making sure we're having ongoing dialogue and ongoing conversations with the patient and any other involved parties, whether it's a youth athlete, whether it's collegiate, professional, or anywhere in between, just to make sure that we are all on the same page and all progressing forward with the same goals and same intentions. So, Christian, appreciate having you on here. I know baseball is your passion, so I'm glad that you picked this article. Hopefully we can get a radar gun in the clinic sometime and see if you can still top out. What's the fastest you've thrown?
High 80s somewhere. I don't think, to my knowledge, I ever hit 90, that's something that still eats at me a little bit. But
I've never hit, I don't even know if I've hit 60 before, so you got me beat there. Christian, appreciate having you on. Stay tuned for the next month. This will be a monthly recurring theme with our journal articles for you listening. If you have not had much exposure to the baseball community or to the throwing athlete, I would highly encourage you to look up throwing mechanics in general, and I think that would be a great starting point for really appreciating the literature discussed today and future interventions that you may have.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.